A small pupil is a relatively common scenario encountered by the cataract surgeon. A non-dilating pupil can be due to pseudoexfoliation, post-trauma, post-uveitis, systemic diseases like diabetes, and pharmacological agents. Small pupil during cataract surgery can affect all the steps of surgery, right from the capsular excess to the IOL insertion. It can pose challenges by limiting access to the surgical field, cause iris trauma, increase inflammation, zonular dialysis, posterior capsular rupture, nucleus drop, and a retained lens material. A well-dilated pupil is a gateway to a successful and smooth cataract surgery. However, the cataract surgeon might not always be lucky enough. Many techniques of pupil expansion can be used during cataract surgery. Pharmacological agents such as a combination of tropicamide and phenylephrine, preoperative use of NSAIDs, and intracameral injection of mydriatic agents can be used to dilate the pupil. Viscomydriasis involves the use of high viscosity OVDs such as Helon 5 to dilate the pupil. In situations where the pupil does not sufficiently dilate with the above methods, 4 main surgical maneuvers can be used: synechia lysis, pupil stretching, iris cutting, and mechanical pupil expanders. Here we are doing the pupil stretch with the help of 2 wire rods introduced through the paracentesis incisions located contralateral to each other. The main idea of this maneuver is to stretch the pupil in vertical and horizontal meridians to create small sphincter tears in the fibrotic iris tissue and to expand the pupil. Although it is simple and effective, this manipulation may not provide sufficient mydriasis. It can cause iris bleeding and pupil atony postoperatively. Multiple sphincterotomies performed with fine scissors such as Varna's or vitreoretinal scissors share the same mechanism of action with pupil stretching technique. Iris hooks is a popular pupil expansion device introduced through peripheral paracentesis incisions. The hooks are introduced parallel to the iris plane, catching the edge of the iris. Now the sleeve of the hook is adjusted to expand the pupil to the desired size. The advantages of this technique include the ease of manipulation and availability of the hooks in different sizes, materials, and design. In addition to iris hooks, we have other popular pupil expansion devices such as the Malaysian ring, the ring, the B-hex pupil expander. Minimal bleeding can occur with all of these techniques, but it usually settles on its own. Tips to remember in the case of a small pupil. Tip number 1: thorough preoperative assessment of the pupil size, medication history, presence of pseudoexfoliation, posterior synechia, and the grade of the cataract. Tip number 2: intraoperatively to decide the technique of pupil expansion according to the pupil size, the grade of the cataract, and the presence of other associated features. Tip number 3: try and keep the iris damage to the minimum level. Tip number 4: adequate post-operative anti-inflammatory measures to be taken. Hope you found the tips useful in managing your next case of a small pupil.